Welcome to another episode of our personal empowerment audio program, Finding Yourself in Paradise. Hi, I'm Michael Benner.
And I'm Steve Snyder, and our program today is on a topic called depression. Now, this is interesting because we've been doing these shows for 4 or 5 years in one form, radio or podcast form, one form or another, and I've thought about that as a topic many, many times, but I've always put it off. I've always hesitated to do a show on this topic because I don't have any personal experience with it. I've never actually been depressed, but I've done a lot of reading, and it really is a fascinating topic. So today, let's tackle one of the most difficult experiences there is in being human, the experience of depression.
I guess that's better than saying we've never done it because I've always been too depressed.
Yeah, way better than that.
Yeah, didn't want to bring it up. I think everyone knows the emotional feeling of depression, and you might even call that depression and say, yeah, I've been depressed, or I get depressed sometimes. Sad, sometimes lonely. We talked a couple of weeks ago about alienation, like nobody understands me. I feel really isolated. Blue, melancholia, they called it in past centuries. But we're going to distinguish here at the top between major depressive disorders and the much more common anxiety-related depression, because we need to talk about what you can and cannot do by yourself to manage what you may be calling depression. So I suppose we could say there's a capital D depression, major depressive disorder, and then the kinds of emotional feelings that we all go through and may call depression.
There are other kinds of depression besides major depressive disorders, which is also called clinical depression. I mean, there's postpartum depression, which you have often after having babies. Women have this. And then there's this kind of anxiety depression, which is confused with depression, but it's an up and down. It's a sad one day and less sad another day kind of thing. It's a flowing thing. It's not a just stuck in the depths kind of depression. And then there's what used to be called manic depression, now called bipolar disorder, where you have bouts of high anxiety and then bouts of no energy. And there's also kinds of depression like psychotic depression with symptoms of hallucinations and all kinds of. But what we're talking about primarily is those things that aren't depression, that are called depression, the sadness, the melancholia, the being stuck in the blues kind of thing. Then you can do something about it. But if you really have major issues with depression, I mean, you're probably not listening to the show, but if you are, with major, clinical depression, this is something where you need help. And what you really need is psychiatric help. It's all too frequent that regular medical doctors, internists, what used to be called general practitioners, will prescribe antidepressive drugs to people when maybe there are better ways. It's not to that point yet. It's not necessary yet to do that. But if you're in, major depressive disorder kind of stuff, you need to see a psychiatrist, and most likely, probably they'll prescribe drugs along with some other kinds of positive thinking therapies for you. But before you get there, if you're not there yet or just going through a bunch of sadness and related to difficult situations, there are things you can do to avoid getting into that situation of being in a major depressive situation, especially if you don't have such strong genetic predisposition and such strong outside indicators. You often can catch yourself before you go there, and that's one of the things we want to talk about today.
Yeah, the word that I'm hearing echoing in my head while I listen to you, Steve, is appropriateness, in terms of the levels or the degree of intervention. In other words, if you're having a depressed day, you got the blues, you don't go in for a lobotomy or electroconvulsive therapy, ECT. They used to call it shock treatment. That's still performed today in very difficult and resistant cases of depression.
They really don't do lobotomies too much.
No, they don't do that. They do the ECT. Yes. And many people think it's just as barbaric. But there are people that say, well, it was the only thing that helped. But that's not where you begin. That's our point. You don't start with some major intervention. There are all kinds of things you can do, starting with just determining, is this anxiety related? Is this depression or this sadness, is it emotional in nature? Does it have an ebb and a flow to it? Does it never last more than 3 days, for example? Do you have mood swings within that sadness and depression? Do you have a sense of hope or a recollection that in the past when you felt this way, it didn't last more than a day or two, well, then it's likely you have the much more common anxiety-related depressive emotions, which is what we're going to really talk about today in terms of how to recognize that and what to do about it before you go to a more serious kind of intervention, like asking your doctor, can you give me something for this? Well, they've got a whole long list of often serotonin reuptake inhibitors. You may have heard of SRIs. This is the Paxil and the Prozac and the Zoloft and the Wellbutrin, and there's dozens of them. And they're so prolific that they're, believe it or not, in our water supply now. It's in the rain that rains down upon the planet. Because these drugs are just so widely prescribed, people ask for them, the doctors shrug, they say, they're asking for it. Well, the drug companies, of course, are advertising. Do you remember? It wasn't that long ago when it was illegal for drug companies to advertise medicines on TV. Over-the-counter meds have always been advertised. But like cigarettes and certain limitations on alcohol, drug companies were never allowed to advertise prescription-based medicines, but with enough lobbying, they were able to get laws passed that allowed them to do that.
But not enough lobbying to get them to be able to do it without those, side effects may include death,
Your arms falling off.
Yeah, right. It's like those commercials, those prescription drug commercials, they scare me because the side effects is what I hear much more loudly than, of course, if I had the symptoms, I'd probably be paying more attention to that. But it wasn't that long ago that wasn't legal to do. And I have some pretty strong objections to it being done. I mean, people really need to understand that drugs are a wonderful, wonderful methodology for dealing with some of these situations, but they're not a first resort. They need to be a last resort. And so there's so many things we need to do before we resort to taking these drugs. It's not go running to the shelter of our mother's little helper. We can't live like that. We can't just grab drugs whenever we're feeling bad or feeling low or feeling like we don't have enough energy to go on. There are way better ways, because one of the worst things about doing it with drugs is that they start to wear off, and then you start to build up a tolerance to them, and you need more and more of them to get the same result you were getting before. They're wonderful when necessary, but let's take a look at how we can get to the point where we don't need to take those drugs, don't go so far into that sadness that we fall into the real depression.
There's even some ethical problems, I think, or ethical issues with these SRIs, in that many doctors will allow patients to presume that the medicines are supplying some ingredient, some chemical or compound that's missing in their brain. And that's not the case. What an SRI does is prevent the body from flushing these neurotransmitters, serotonins and other neurotransmitters. This is the electrical goop that your brain sits in that allows the impulses to go across the synapse, or the gap between brain cells. Well, all an SRI does by preventing your body from flushing that out is allow for a gradual buildup of those serotonins. So ideally, this may be intended to bring you back to a normal level, but more often than not, what it does is create an excessive level, an unnatural level of serotonins, and you come to rely upon that. And then the body may respond by shutting down serotonin production, so you really create a vicious cycle. And often, as we said before, your family practitioner, the GP, the primary care physician, the internist, is prescribing these drugs when what they really should do, and if you're going to ask for help, ask them to refer you to a counselor, to a therapist. And that therapist may then refer you to a psychiatrist, who's a medical doctor who specializes in this. You certainly wouldn't have your family physician do heart surgery or a knee replacement. They'd refer you to a specialist. Same thing with these serious major depressive disorders. You say, well, what if I just have a little bit of depression? Couldn't my family physician handle that? Yeah, but then why are you jumping to the drug when there are alternatives? And that's our point today in letting you know that we need to be appropriate in gradually scaling up our response to sadness, melancholia, the blues. Is it really a major depressive disorder, or is it just the ebb and flow of living in an anxious world? In most cases, it's the latter, and we're going to help you with that today. We're going to help you spot it, identify it, and know what to do, as well as when to ask for help.
Everyone has sadness. It's a natural part of life, and it's appropriate to be sad. Depression always includes not only the feeling of sadness, usually intensely or over a long period of time, but it also includes a strong feeling that I shouldn't be sad, that this is bad or wrong of me to be sad, that I am inappropriately sad, and I'm angry at myself, or I'm frustrated with myself, or I'm beating myself up because I can't bring myself out of this sad. To me, depression equates to like falling in the lake and you can't swim, and you're going down and you're fighting your way back up, and you're going down and it's pulling you down and you're fighting your way. At some point, you get to the point where you're just totally exhausted, and your physical body is exhausted, and your emotions are exhausted, and there's nothing left, and you just fall, you just drown. You don't just accidentally drop into depression. You fought, but at some point, the circumstances combined with these genetic things inside of you, combined with how much sadness you've had and how anxiety-ridden your thoughts have been, all those things together, at some point you just exhaust all the systems and you fall. We did a show a little while back on that spiral, that negative spiral of thinking down, down, down. And once you're depressed, that's all done. You're exhausted. You don't have any of that anymore. You're just exhausted. You're just through. You don't even want to get out of bed. You don't want to. Nothing excites you. Nothing interests you. Nothing makes you want to do anything. You've burned out everything. All this it's emotional exhaustion, absolute, total, and complete, chronically fatigued, emotional exhaustion. And so you can see that what leads us to that is not sadness. What leads us to that is the feelings we have about our sadness, that it's wrong to be sad, or it's bad to be sad, or I'm angry at myself that I'm sad. If we can be accepting of the fact that, well, for example, my mom just died just a few weeks ago, and I'm sad about that. If I were upset at the fact that I was sad, or feeling guilty about not feeling sadder about that, or whatever, mixing all that up together, that gets to be a cocktail that creates real significant challenges for the brain to handle. But if we take it one step at a time and realize I'm sad, okay, why am I sad? I know why I'm sad. Is it okay to be sad? Well, of course it's okay to be sad. My mom just passed away. Of course it's okay to be sad. Being sad's not dangerous to me. Being sad's not a bad, terrible thing. Being sad's not going to lead me into any depression thing. Being sad is something that I get to go through and grow from and ultimately get better because, as we always say, adversity is the diamond dust that shines us. It's the hard stuff that we go through that makes us stronger and better. And so sad's a good thing. It's the judgment, it's the needing to be different than it is that causes the pain, that causes the anxiety, that causes the depression.
Yep. So let's be clear. A major depressive disorder, and it gets its own category and its own number in the DSM.
It almost always has suicidal thoughts involved with it. It's big time.
It's so big time. Steve talked about exhaustion. One of the symptoms of major depressive disorder, big time capital D depression, is you can't get out of bed. There'd be no point in getting out of bed. You don't have any energy. And often people just sleep and sleep and sleep. Sometimes this gets confused with Epstein-Barr and other chronic fatigue symptoms, and all mixed up in people's minds. There's also the hopelessness that Steve talked about. And this is something you're going to want to get some help for and not allow your primary physician to treat you with SRIs. Say, no, I need some counseling. Go to a psychotherapist or qualified counselor who then can make a determination if they need to refer you on to a psychiatrist. If, however, on the other hand, and this is much more likely, you're going through emotional bouts of depression or sadness, and we're calling it depression, but it's
small d depression.
Yeah, it's the blues, it's melancholia, it's I'm sad today. Then this is likely anxiety-based, There are these, as Steve indicated, other possibilities. There is a genetic predisposition. There's even medical conditions that can have as symptoms what certainly feels like depression.
Hyperthyroidism, for example.
Exactly. And people say, I'm so depressed. It turns out it's just the thyroid. So you really need to consider all of these possibilities. Just because we call it all by the same name, it's really not the same thing at all. But I think we can say without hesitation that the vast majority of what people call depression is the sadness that Steve's talking about that really is appropriate. And it requires, first of all, acceptance and responsibility. You know, if you look at the dashboard on your car, you may not want those warning lights and gauges to indicate a problem, but you're certainly no better off if you mask them over or ignore them. They're there for a reason, to warn you. And so it is with all of your pain and all of your discomfort, whether it's physical or emotional in nature. These are your friends. Listen to it. Say, well, I'm feeling really sad, really depressed. I'm really bummed out, feeling sort of hopelessness. This emotion is mimicking a major depressive disorder, but I've been here before. It only lasted a couple of days. If it's less than 3 days, if it has an ebb and a flow to it, if you remember times in the past that you went through this kind of depression or sadness and bounced out of it in a few days, it's very, very likely that it's anxiety related. Often people in the field will say this kind of depression is the result of inner directed anger. So, are you mad at yourself? Are you frustrated? Do you feel like you've been trying to accomplish something that's really impossible to accomplish? Maybe you're trying to, boy, I see this a lot in my private practice, please unpleasable people. I can't tell you how many times I've had clients' jaws literally drop in front of me when they talk about what a difficulty they're having trying to please somebody in their circle of friends, families, others, people they work with. And I say, well, are they pleasable?
Dung.
And all of a sudden, this light comes on, and they go, well, no, I don't actually.
I can't remember what occasion when they were.
So, and yet here we try and frustrate ourselves attempting the impossible, right? So it's well-intentioned. It's like all people-pleasing. It's really hard to criticize a people-pleaser because they're so darn well-intentioned. But you're still making yourself frustrated. You're causing your own anxiety, stress. You can call it fear if you want. The mind-body-brain connection is going to respond to that frustration with sadness, depression, a sense of futility. There's another good word for it. Hopelessness. Again, that doesn't mean that you're suffering from capital D depression. This is emotional in nature. Given what we've already said, this is likely emotional in nature. We have an antidote for anxiety. It's basically understanding. If you accept responsibility for this feeling, if you can say, well, my sadness is appropriate, it's perfectly understandable, anybody in this situation is likely to have very similar feelings. If you can pass that little test, then you can apply the stress management, the anxiety reduction antidotes that we're going to talk about today.
Yeah, it's sort of fascinating. It's not the feeling. It's what you feel about the feeling. It's what you think about the feeling. It's your experience of the feeling. If the feeling of sadness is a feeling that you go, well, that's perfectly appropriate. Like Michael was just saying, like, yeah, of course I'm sad. I lost a loved one. Of course I'm sad. Then there's no spiraling down that goes from that. In fact, there's an upliftment that comes from that understanding, from experiencing, from going through hard stuff. But it's when we start doing the judgment thing about that feeling of sadness. Oh, I've felt sad way too long now. Oh, I'm never going to come out of this sad thing. Oh, this, everybody else is looking at me like I'm a loser. All of a sudden we start making judgments about this sad thing, and that becomes this inner directed anger. And that often called frustration. It's a seething. It's like a volcano that's not erupted yet. that stuff inside of us, that anger inside, that's not depression. There's lots of energy in that. And so when you're feeling that sadness and you're angry and you're holding on to that, all that wanting the is to be other than the is, all not accepting of the way things are. When you're in that, you've got a lot of energy to work with. And it's way easier to get out of that scenario than it is to escape from depression. Because like depression, you're talking about no energy at all to work with. Here you've got a lot, and in fact, an excess amount of energy to work with. It's just reversing it from the negative into the positive. It's just turning it around. It's just using this energy like we were talking about the martial arts. You use the energy against itself. And so all this negativity can be just transposed into positivity. It's energy to work with. So I'm much more encouraged when somebody comes to me and they tell me how frustrated they are or upset they are, or they're just not okay with the, rather than somebody who says, well, it doesn't matter, I don't care, nothing matters, it's all hopeless. Give me energy to work with, and we can do something. So the idea is to be excited about the fact that you have so much energy, even be it negative. Okay, now I've got stuff to work with. I've got this energy that's in me. It's like flowing, it's moving, it's bringing me up, it's taking me down, it's creating moods, it's creating attitude changes, it's doing all kinds of stuff. Now I can get a handle on this and start to reverse it and start to turn around. How do I do that? How do I get a handle on all this energy that's I've been calling anger or frustration, or just the seething inside, the sadness that's lasted way too long? How do I get a handle on that? Is to step back, to go to paradise, and to observe it. To step out of it, to become the consciousness that observes this experience and grants yourself permission to feel exactly the way you feel.
We also need to make sure you understand the proper definition of acceptance and responsibility. This is a very important point because too many people think of acceptance as giving up and responsibility as self-blame. We're not talking about these words in that way. We're talking about acceptance as a place to begin, not a giving up. Like, get real, this is where you are now.
This is the starting line, here we go.
Exactly, this is what you push off from, all right? And responsibility is not self-blame, but it's also not blaming circumstances. It's, I can choose an appropriate response. When you look at responsibility, take it apart and see it as the ability to choose a response. That's very empowering. It's very liberating. This is the freedom that we fight for. Politicians don't tell you this because they're not really trained in psychology, but this is really at the core of what liberty means, the freedom to choose your perspective and response, even if you find yourself blindsided by circumstances. So acceptance and responsibility are both very empowering concepts. Acceptance, this is the way I feel. As a matter of fact, now that I reflect upon it, it's perfectly understandable that I would feel sad, lonely, depressed, stressed out given what I've just been through. And by taking responsibility, that means I'm going to explore it. I want to understand it even more. Remember, everything that hurts is rooted in fear, by any name, stress, anxiety, and that's a first cousin of confusion and ignorance. Fear and ignorance, they go hand in hand. Just like love, peace, and understanding go hand in hand, except love and understanding is a beautiful upward spiral where, as Steve has already indicated, fear and ignorance, confusion and anxiety is this horrible downward spiral. You have to breathe, first of all. You have to tell yourself that you're safe. The brain isn't sure. It's just an organ. It needs consciousness, your mind, to instruct the subconscious mind and the brain, hey, we're safe. This is a feeling. This is an emotion. Now that I look at it, it's appropriate. It's really understandable. I'm accepting the truth of the situation. I'm taking responsibility, meaning if I look at it now in a state of relaxation where I feel safe and understanding is promoted, and I can get new insights and an even bigger picture of why this is happening, that'll relieve the anxiety that supports the sadness and the depression, don't you see? And it'll just vaporize. It'll cease to be in the presence of understanding. Is it that simple? Well, yeah, if it's anxiety-based, if it's got an ebb and a flow, if what you're calling depression is really sadness or a feeling of depression rather than what we've already identified as a major depressive disorder, yeah, it will respond to understanding, no question about it.
If you can get to the point where you can experience the sadness and go, well, what's so bad about being sad? It's perfectly okay to be sad. Then that doesn't bring you toward depression. In fact, it brings you toward a sense of fulfillment, a sense of growth and experience and joy. So it's really your opinion of your emotions. When you blame yourself and think you're bad or wrong for feeling an emotion, like sadness, for example, then that's where that anxiety comes out. If it's perfectly okay to be sad sometimes, if I was sad all the time, clearly there'd be a big problem here. But it's, if I were never sad, then I wouldn't know what happy felt like. So it's perfectly, the yin and yang of it all, it's perfectly okay to experience some sadness in our lives, especially in relation to difficult events or sadness-provoking events that happen in our lives, circumstances that are difficult to handle, losses and stuff. So it's not sadness that causes depression. It's your not being okay with it. It's your fighting against it being an appropriate experience for you to be having that you need to deal with. So, as Michael said, the first step is always to breathe. Once you start being conscious enough to choose to take a deep breath, you've stopped fighting yourself. The war is over now. You've laid down your swords, As long as you feel in danger, then the natural inclination, the fight or flight instinct kicks in and you want to fight yourself. But as soon as you feel safe, as soon as you take a deep breath, and that's what the brain needs to know that you're safe, one really slow, deep, conscious breath really changes everything. And all of a sudden, we're not at war now. Now we're on the same team here, and now we can move into that place of acceptance. Again, that doesn't mean resignation. It doesn't mean surrender. It doesn't mean giving up and yes, it'll always be horrible like this. It means, yes, it's sad. I'm sad right now, but it's okay to be sad right now. And now that I'm out of this stress, out of the anxiety, now that I'm in paradise here, it's also okay sometimes to imagine what it's going to be like when I'm happy. Set the target to see the end in mind, to go like, I know I'm going to go through this sadness experience for a little while, but, it's not forever. And on the other side of this sadness, here's what I have to look forward to. Here's what I have to feel grateful about. Here's what I have to shoot for in terms of goals and dreams and visions. It's okay to be sad. You don't have to be sad 24/7. And sometimes it's real important to take a step back, observe the sadness, accept the sadness, and then take a vision of, well, like the martial artists don't hit the board. They see their hand on the other side of the board. You imagine yourself on the other side of this sadness, having recovered and grown from it and starting to experience the experience of happiness.
It's also important to be aware of what may for you be a self-critical nature. You may be hard on yourself. You might beat yourself up. You might say something like, well, I deserve this. This is my life. A kind of self-punishment. Especially people that feel that they're being constantly judged by some divine presence, that they're born sinners, they're just inherently bad people, and this is God's punishment right here on earth is to be sad. I don't deserve it. I can't handle a happy life. In many ways, although you're creating your own misery, it's easier for people to do than accept that they're good, that they do deserve it, that they can handle it. Another variation on this might be if you say to yourself when you're sad or lonely and feeling a little incapacitated by it, oh, I can't afford to do this. I don't have time for all of this. And you rush through it because your priorities are bent and twisted. Yeah, you do have time to live your life. If you don't, if you're not allowing yourself to experience the full depth and breadth of all of your feelings, positive, negative, and everything in between, well then, what kind of priorities are those? So busy trying to earn a living that you have no living remaining. You know exactly what I'm talking about. People will say, well, I'm working 80 hours a week for my family. Yeah? What family? Where is the family in that, you see? Look, if you want to bear down at a certain period in your life and have family meetings where everybody understands this is going to be this way for a short period, that's up to you. But life is short. It happens fast. Don't wait till you get, God forbid, some horrible disease to reassess and reevaluate and then say, why am I doing this? I mean, nobody ever came out of some major surgery, found that they survived, and then thought to themselves, I really need to spend more time at the office. We come out of those situations saying, what am I doing? Why don't I reserve some time in my life to enjoy my life? The people that I love, my family, my kids, my parents, my friends, my neighbors, everybody's working. It wasn't that long ago that one person in the household, it was usually dad, but it could have been either mom or dad, worked. Even if it was blue collar. They could still own a house, a nice car, support their spouse, and several children. Those days are gone. In most cases, we have to have both adults working. You can see what impact this is having on the children. They come home, nobody's there. They're angry, they act out. And in the last decade or so, it's gotten even worse. Not only do both parents work, but now they're working extra time. 50 hours, 60 hours, 70 hours a week. And in many cases, aren't even getting paid for it. No overtime. No choice, no option. Why? To pay the bills. Why? To live the life that you don't have any time to enjoy. This is madness. And throughout my life, people have complained about the rat race and the treadmill existence of it all. But how do we get off? How do we get out of the rat race? How do we get off the treadmill? Well, it's a matter of reestablishing new priorities and deciding what's really important. Don't wait till you get the catastrophic disease to decide your priorities are twisted. Put yourself first. There's great resistance to this. You've been told all your life that's a selfish thing to do. Well, if you put yourself first and then behave in selfish ways, it is. But if you put yourself first so as to be the best you can be for the people that you love in your life, that's a different self. That's not the separative ego. It's the higher self you find in paradise. And that self can reorder your priorities, can catch yourself when you start going astray and getting confused, and creating that frustration that leads to the anger that you end up blaming yourself. Inner-directed anger becomes depression, frustration, sadness, loneliness, a sense of, why am I doing this? What is my purpose in life? The only thing that's missing for most people is a little bit of reinforcement. So find people in your life that understand this, who are happy. Find somebody in your life who's happy and look very carefully at the way they organize their lives, the way they set priorities, what's really important to them. So much of psychology in the past has been trying to fix what doesn't work. Fortunately, in the last few decades, we've begun to study what does work. And what does work is acceptance and responsibility for tailoring your life to be a healthy one.
Yeah, reaching out and finding somebody else is really one of the best things you can possibly do when you're feeling sad and feeling, on the verge of depression. There's a wonderful line from a Leon Russell song a long time ago. He was talking about his depression, and he said, when darkness overcomes me and I'm blinded by the night, I take her hand and she leads me to the light. And that's to me, in like two refrains, what it's all about. When darkness overcomes me, I don't have anything left, and I'm just blind. I can't see any hope. But yet, I have the ability to put out my hand And she takes my hand and she leads me to the light. It's, as long as there's that spark of, I'm not alone in this, it's not all over, it's not hopeless, I know that I have some power, and sometimes all it takes is to like put out your hand and ask for help. Sometimes the depression can be just stopped by those words, "Can you help me?" You know, I'm feeling alone, I'm feeling lost, I'm feeling all by myself here. I just need a hand, I just need a help. And sometimes it could be a friend or a loved one. Sometimes you're best going to a psychiatrist and getting that help, but you don't have to do this life by yourself. We're social creatures, and the anxiety that comes from being alone and feeling like there's nobody out there to help me with this is something that helps lead to that depression as well. So remember just a few things when you're really feeling sad, when you're really feeling lonely, that it's okay to feel all these feelings. That's the first thing. Like, if you let yourself be okay with feeling anything you're feeling, then you're not going to move into depression. And that this is not forever. This is a temporary thing I'm going to go through, and one of the ways I can start my way out of it is to imagine myself being happier and to reach my hand out to help somebody else show me the light.
It seems so simple to say, don't judge, but it requires a practice. To feel sad, as Steve has indicated, as all the great teachers and all the philosophies and really profound religions have said, judge not. Why? Not because you're a bad person if you judge, but it makes you feel horrible to judge a feeling as good or bad, right or wrong. Has it ever occurred to you that there's no such thing as a wrong feeling?
How right on is that?
That even a bad feeling isn't bad if you can learn from it. That's what pain does. It teaches you, stop judging your feelings as good or bad, or indicative of you being a good person or a bad person. And just watch the feeling. And it's like watching clouds. They move, they they change. Nothing really lasts. But Steve's right. Beware of darkness. Beware of darkness. There's no comfort in those shadows, right? Come into the light. Breathe, relax. Let's do it now. An audio journey. Get comfortable. Do some shoulder shrugs and some head rolls and get nice and comfortable in a chair. And just begin to breathe, slowly inhaling through your nose. Fill those lungs. Hold for a moment as you peak, and then exhale just as slowly through the nose or the mouth. Feel the letting go. And do that again 3, 4 times. Nice, slow, deep breaths. And as you relax, the sigh of relief. Give yourself permission to relax and feel safe.
As you find yourself in paradise, imagine yourself in a peaceful place, a calm, serene, and tranquil space. Paradise. Not only is it beautiful, but it's really safe. It's a most spectacular place to be. Here in paradise, where you breathe deep and evenly. Your body feels relaxed and your emotions are calm and confusion is completely abated. Now your mind is relaxed, your body feels safe, and your heart, it starts to feel elated. Because in this space, in this paradise place, one thing that's real easy to do is to take a step back and see the bigger picture. Let the consciousness, the higher consciousness come through. And from this place, what's easy to do is to feel acceptance for you being you, for feeling what you're feeling, and for going through whatever it is you need. Because feeling a feeling is always healing. And you'll find from this space, it's very appealing. Feeling the feeling, you'll find very healing. and very easy to do from this paradise place, this higher consciousness space, observing and healing you.
Learning to love yourself, to trust yourself, and to comfort yourself is a little tricky, because we always believe there has to be someone else involved. If I'm going to give my love away, there's got to be another. Or if I'm going to receive love, it must come from another. So in these states of relaxation, when working on anxiety and sadness, think of yourself as that part of you that's sad. It may be a part of you that, in your imagination, in your mind's eye, looks very much like the person you've become. Or it may look like some sub-personality, sort of a character or a role, perhaps. It's also just as likely to appear to you as someone you were in the past. A child, maybe a very young child. Well, in any event, however that sub-personality, the part of you that's sad and lonely and depressed, however that occurs to you, imagine right now, without needing to move at all physically, just imagine yourself opening your arms and receiving this person in a nice, warm, gentle but firm embrace. An embrace that you're not quick to end, not one of those embraces where you hug somebody and pat them on the back. I'm talking about a nice, gentle but firm holding, as you would a little child who perhaps has had a bad dream or a nightmare. And you hold them and you rock them. If the child is young enough, you might sing a little lullaby and say everything's going to be okay. Often this will bring about an insight or an understanding of why this part of you feels sad and lonely. You can at once be the one who needs understanding and the higher self that provides the understanding, that listens, that experiences fully and completely some hurt, some longing, some sadness that perhaps you've been pushing away. Something that needs expression. Give it words. Give it a picture. Give it a color. In a few moments, when we end this exercise, you may want to find some other way to express the anxiety or the sadness. If you like to sing, you might want to sing a sad song, sing the blues. If you're a dancer, you could dance a sad dance. If you're a painter or a sculptor, paint something appropriately sad. Express it, get it out, let it go. You see, let it have its way with you fully and completely. Maybe the pain wasn't really the sadness or the anxiety beneath it so much as it was your resistance and your refusal to allow it to have its way with you. Let it come to you as that sad, lonely part. Embrace it, love it, understand it, and release it.
Because feelings healed with full expression will never lead to deep depression. Feelings healed with full expression will never lead you to depression. In fact, take some time in an inner mind session. Allow the feeling and the full expression and release any fear of any future depression. Yes, you can. And I trust that knowing you can, knowing that you can, lets you realize that you must. In a few moments, I'm going to ask you to come back to wide awake from this experience. We want you to take the feeling that sadness is okay to feel. Feel it, express it, allow it to heal. And depression will not be your destination. So as it feels comfortable for you, become aware of your surroundings, take a deep breath, open your eyes, and come back to wide awake. Wide awake from that place we call narrow awake, back to the world of wide awake.
Welcome back. Feeling better than before, no doubt. You know, essentially, we're okay. We go through things, but just like physical illness, you catch a cold, you cut yourself, you break a bone. You know, the body has this remarkable innate intelligence where it heals itself. It really wants to do that. You see this in nature. You know, you prune a plant, it doesn't die, it just grows off in another direction, right? What is this intelligence that causes the flower to turn toward the sun and then follow it across the sky? You know, the whole universe wants to grow, it wants to heal, it wants to learn and understand, and you're certainly part of that. So the wind is at your back, always, 24/7. The wind is at your back. Thanks so much for being here. Hope you'll share this program with friends you know who could benefit from it. And join us next week for our next episode of Finding Yourself in Paradise. As always, be gentle, love life, and take care of each other. For Steve Snyder, this is Michael Benner. Aloha from Maui.